Hi, how's it going?
Good.
Good. My name's Saren. I'm a student physical therapist assistant. I'll be helping you out today. Can you just confirm your first and last name for me?
Tucker Usher.
Awesome. Thank you. All right. So I see here we're having a little bit of neck pain. How would you describe that pain on a scale of 0 to 10?
When it gets bad, I'd say it's like a 7 out of 10.
7 out of 10?
Yeah.
Okay.
It's pretty bad.
And then where exactly are you feeling that pain? Is it higher up towards your head or lower down?
It's a little, not at the top of my head here, but kind of down a little bit.
Okay. All right, and I'm seeing in the chart here that's around the C6, C7 area.
Yeah.
So that's what we're going to be addressing today. Basically what I have planned for us today is we're going to do a little bit of cervical traction. So we have this table here and a couple pieces of equipment that I'll hook you up to. You'll lay down on that. We'll lay your head in there, and then it's basically going to pull your head and elongate the spine a little bit, put some space in between the vertebrae, ideally relieve some of that pain. So we'll go through that and kind of see how you respond. Just let me know how it feels as we're going throughout. So we will be putting you inside of this apparatus and kind of securing your head to that, and then I'll be pulling you away a little bit. I'll be hands-on and I'll be helping position you. But do I have your consent to do those things?
Yeah.
Awesome. And then a couple things I just want to make sure that this is a safe treatment for you. So I just have a list of things that I want to make sure will allow us to do this. So just answer yes or no if you have any of these. We'll make sure to stay away from any motions that are contraindicated. And then a couple of things that I want you to look out for is any changes in pain. So if the pain that you're having goes to different areas of your body, travels a little bit longer, or if it completely goes away, just let me know, okay? Do you have any acute inflammation?
No.
Or injuries? Do you have any joint hypermobility?
No.
Any uncontrolled hypertension?
No.
Structural diseases?
No.
Any displaced annular fragments?
No.
Medial disc protrusions?
No.
Do you have any issues lying flat on your back or on your stomach?
No.
Good. So I'll be strapping this onto your head, so I'll keep an eye on that just to make sure that's not too tight. If that feels uncomfortable at all, just let me know. Do you have any history of claustrophobia?
No.
Feel any disorientation today? Good. Do you have any TMJ disorders?
No.
Or any dentures or?
No.
Good. All right. So it looks like we're good to go there. So we'll go ahead and go through the traction process. I'll get you all set up here, and then we'll get you good to go, okay? So I just got to set this up here. I want to make sure that this is all good. So we'll use this apparatus here, and this machine to take you into the traction table. Basically, this allows it to slide. The machine here will pull. We'll have you lying here when it's time. We'll secure you for that. Have you ever used a traction table before? Done any traction?
No, I have not.
Okay. So then we'll keep this here. For the first time, we'll kind of go a little gentler. See how that affects your symptoms. Let's get this adjusted here. Stag. We're only going to go for 10 minutes today, okay? We'll have a minute on either side for that to increase. Perfect. And then I just want to measure here, make sure we're getting a good angle. So we're looking for about 25 degrees. All right, so I'm gonna have you lie on your back for me, just with your head right on here. This is good. I'm gonna tighten these in. I just want to I want this to feel snug but not tight or painful, okay?
Okay.
How's that feel?
Feels snug in there.
Okay. Make sure there's no space. This little headband's gonna go over your forehead, okay? This is just to make sure your head doesn't move. We'll use your this down. Feel okay?
Yep.
Perfect. All right. I'm gonna give you this red button here. So if any point in time throughout the treatment you need to stop, you can just press that button. That'll stop the machine, and then we'll be able to go ahead and get that adjusted. Okay. I'm just gonna grab you a little call bell as well if you need to stop that. If you don't need to stop the treatment, but you need something from me, okay? Let me grab that real quick. And I'll leave this here for you. I'll just set this down here so you can call me. Okay. All right. So I'm gonna get this started. It's gonna slowly start to pull. It'll pull gradually for a minute, just until we get up into that full weight. Okay. And so while this is pulling you out, as you start to feel that pressure, definitely let me know if you have any changes in that pain.
Okay.
Like I said, if it travels to any other part of your body, or if it goes away completely.
Okay.
And we'll keep an eye on your positioning as we go through. We can kind of change this if this is something that's beneficial. You can have that pull with different values of the weight.
Okay.
And then also kind of a pull and relax alternating cycle, okay? So let this pull you up. That's about max weight. Does that feel okay? Do you feel a little bit of pull?
Yeah.
Okay. Perfect. So we'll let that go. And so this is gonna run for 10 minutes. I'll come back and check on you in about 5, okay?
Okay.
In a second. All right, it's been about 5 minutes. How are you feeling?
Good.
Any changes in pain?
No.
Doing okay?
Yeah.
All right, perfect. We've got about 5 minutes left, so I'll let you finish out that last little bit. Once it gets to the last minute, it'll slowly start to push you down. I'll press the button and we'll get you out of there, okay?
Okay.
All right, be back in a second. All right, just about done here. We'll let this go out. This will slowly release you there, okay? All right. Let that come out. I'll grab this for you and then we'll get you out of the machine. So once I get you unstrapped here, I'm just gonna have you stay laying down for a second, okay?
Okay.
Perfect. Okay, next we're gonna sit up to the edge of the table. I'll help you sit up, okay? I just want you to do this nice and slow in one motion. So you can grab onto my arm right over here. I'm gonna swing your legs off the table. I just want you to sit up for me, okay? Ready? 1, 2, 3. Straight up. Good. And so we're just gonna sit here, okay?
Okay.
I'm gonna sit for a minute or two after these sessions. We have put a little bit of space in between the vertebrae in your spine. So we're gonna kind of let your body reacclimate. Gravity's gonna start pushing back down onto that. If you have any changes during that minute, definitely let me know. And if you have any changes in your pain as well throughout the day, it's called the rebound effect, which is basically like we've put a little bit of space there, and then now it's kind of going back to where it was before.
Okay.
Might feel a little increase in pain, but let me know if that starts to get to be too much, okay?
Okay.
But while we're sitting here now, during the session or after, did you have any changes in pain?
I'd say my pain decreased a little bit on the machine.
Yeah.
But maybe to like a 4.
A 4?
3 or
Okay.
4.
Awesome. Yeah. Well, that's good. So yeah, this is kind of the goal of this is just to kind of manage that pain a little bit. Just kind of add something in to help relieve that. So when we come back in, we'll go ahead and try that. The next time we can do something a little bit different in terms of the weight. But we'll give that a try and see if we can get that pain under control.
Okay.
Do you have any questions for me?
I don't think so. No.
All right. When you're all set, we'll get you all set next week, okay?
Thank you.